So this is your Mastopexy breast reduction pre-op. What we see for in a pre-op is similar in all pre-ops, and in the Mastopexy breast reduction pre-op, there's three main things we're going to be doing. Stacy, our physician's assistant, is the one who usually sees you for your pre-op, and so she's going to have lots of questions for you, and you may have a lot of questions for her. It's important, as Stacy always tells people, that they should, what's that, Stacy, read their packet?
Yeah, make sure that you're going to be receiving your an email from our coordinator once you schedule your surgery, which is going to have all your consent forms in there. We want to make sure that you read thoroughly through that because if you have any questions in regards to that consent, you can ask that day. But we're going to make you sign those consents that day, as well as make sure if we've requested for you to get any labs, any EKGs, any mammograms done prior to your surgery. We want to have those done. We want to have you have completed those prior to your pre-op visit. It's imperative that we have those things before your surgery, obviously, so it could delay your surgery if we don't have those a couple weeks prior to your surgery. So if we've requested that, please have that completed as well. We will also, as far as advise you, especially breast lift and breast reductions, we also request you to get some compression bras. Okay, we'll start from where?
You just talked about the pre-approval of your labs.
Yeah.
Right.
Okay.
I said also is important.
Oh, okay. We will also request that you get some compressive bras to wear. We will wrap you after surgery in an ACE wrap, but at a couple days after surgery, we will request you to have some compression bras that you can put on. We put you in a surgical bra, but after that time you will switch it out and get into some type of compressive bra that's going to keep things held up tight and placed where Dr. Green has put them.
We want to keep them in the right spot.
Mm-hmm.
So the main things that you'll have when you come back for your pre-op are the consent forms in your packet that you will have read through. And Stacy talked about how important that is you read through that. And the real important reason that you do that is so that you know what questions to ask. So we want to make sure as physicians and healthcare providers that we've answered all of your questions, that we guide you the best as possible. We give you as much information as possible for you to make good decisions for yourself. You got to know this is the right thing for you to do. And part of that is you educating yourself. There's a lot of information out there on the internet. Some of that's good, some of that's bad. Our goal is to give you all of the right information so that you know the truth about things, how your recovery is really going to go, what to expect in surgery, what to expect immediately after surgery, so that you really can make the best decisions for you. And part of that is reading all that information and having all that stuff ready to go. So that pre-op is a super important time to be able to ask those questions and have that knowledge and gain that information, just like the consult is to get that initial knowledge. So we talk to you through the whole process, talk you through everything. Each time I see you, we give you more information. So there's lots of different steps along the way, and the pre-op's really an important one. Another part of the pre-op is we're going to take pictures of you at that time. And so we're going to have you come in and disrobe for us so we can take pictures of your breast for mastopexy or breast reduction, and we can see the differences from side to side. Now, we can't always make those differences exactly the same. We can't always fix all of those differences that a patient has from side to side, but we want to do as much as we can. For example, if somebody's breast on one side is larger than it is on the other, which frankly is almost 100% of the time, we want to be able to try and get those as symmetric as possible for you. So your clothes fit the best they can, your bathing suits fit the best they can, everything fits you the best it can, and you're happy with your result post-op. Those pictures are super important in us being able to achieve that for you. Additionally, Stacy's going to give you some prescriptions for pain medicine. And typically we use a narcotic pain medicine. So if you haven't taken narcotic before, Norco is the most common one we prescribe. But if you have particular ones you like better or seem to work better for you or don't make you nauseated, then we're happy to prescribe those for you instead. Also, speaking of nausea, we prescribe an anti-nausea medicine for you called ondansetron or Zofran. Ondansetron is a medication that's very, very good at stopping nausea. Our anesthesiologists try and do all they can to try and prevent you from having nausea, and they're great at doing it. Most patients tell us that they've had a wonderful experience. It was the best anesthesia experience that they ever had. But that being said, Women sometimes get nauseated, especially with bigger procedures. So not so much with just breast procedures, but in things like mommy makeovers and stuff like that, and bigger procedures, it's more common, but it can occur even in this. So the anti-nausea medicine is very, very helpful for you to take. You take that on an as-needed basis, what we call PRN, which means you take it as you need it. There's some additional things that I think are very, very helpful for women. Women's blood pressure tends to be lower than men's, and sometimes post-operatively women's blood pressure will dip down into the 80s systolic. And when it does, you're not getting enough perfusion to your brain. And not enough perfusion to your brain, especially when you stand up, makes you want to lay down. Your brain tells you, lay down, I'm not getting enough blood flow, and that can make you feel nauseated. And so hydration, super, super important. And not only with just water, but other things that have electrolytes in it, things that have sugar in it. So this is your excuse to go out and buy that Coke that you wanted. I tend to prefer ginger ale for patients post-op because ginger is an actual antiemetic, a natural antiemetic, which is an anti-nausea medicine itself, is used in a lot of nausea situations. For example, they make ginger patches to go behind your ear and things like that. So ginger is very, very good for that. Ginger ale is great. So lots of hydration, gallon to a gallon and a half a day. Have some sugar. You've been dieting now for 24 hours typically because you haven't been eating since the night before. So you've gone almost 24 hours without any real nutrition. So you're low on blood sugar in your system. Your body's trying to heal. It needs sugar to heal, and it's sucking all that sugar out of your bloodstream to help heal itself. And so your blood sugar is dropping, and we want to replace that by eating and or drinking something that has some sugar in it, stuff like that, to help with that nausea. So your photos, your prescriptions, oh yes, and an antibiotic. Antibiotic prescription will be given to you also, usually one that's called cephalexin, but if you have allergies to medications, we'll prescribe a different one that will work for these purposes of the surgery you're having. Your prescriptions and your consent forms and your packet that you have that gives you all the information. Additionally, if you're having a breast lift or breast reduction, you typically will have had a mammogram beforehand, especially if you're in that age window of over 40. We're going to want you to get a mammogram beforehand and then again after surgery, several months after surgery, so they have that comparison view for you. And I think that pretty much wraps up.
One thing I will mention, if you have a history of any breast cancers or had recent abnormal mammograms, we during your surgery that day, we will send off your tissue, what he removes from you, to a pathology lab. You may see after surgery you get a bill for that, and at that time I would suggest that you contact that lab because many times your insurance will cover that. We don't often send out your insurance card with that, but we do send the tissue. So if you do see that bill, that's just something to know. Sometimes patients aren't aware of that happening. So again, just contact the lab. It's usually sent, it's called DPMG. And if you see that, just contact them and they can take care of that usually for you.
Yeah, and then sending off breast tissue is something that is very, very common in these cases, especially if you have any history. We do that just because that's a responsible medical thing to do, and all surgeons do that in that situation when there's any type of history in your background. So that's an important thing also to in your information you're supposed to fill out. And to us during the consult or pre-op, the patient should be telling us if they have a family history of anything like cancer like that, so that we can make sure we do all the things on our end to provide the best care for you possible. So that tissue sometimes is sent out, but it should be covered by your insurance plan, unless you have Kaiser insurance or some other insurance that that lab doesn't work with, but almost in all situations it's otherwise covered. There you go. That is your, unless you have something else?
I think that's it.
That's your pre-op for breast reduction, breast lift procedures.